Scene script. Ever wondered how medical science tackles life-threatening conditions like severe lung bleeding? One answer is a remarkable procedure called bronchial artery embolization. This process, though it may sound complex, is an ingenious method that helps control and prevent further bleeding in the lungs. So, what exactly is bronchial artery embolization? In the simplest terms, it's a non-surgical procedure that uses a catheter to block off the blood vessels that are causing the excessive bleeding. The process begins with the patient being given a local anesthetic and a sedative to ensure they are comfortable and relaxed. Next, a highly skilled interventional radiologist uses a special type of X-ray machine, a fluoroscope, to guide a thin tube, known as a catheter, into the blood vessels supplying the lungs. This is typically done through a small incision in the groin or wrist. Once the catheter is in place, a contrast dye is injected into the bloodstream. This dye makes the blood vessels visible on the X-ray, allowing the radiologist to identify the source of the bleeding. The next step involves the actual embolization. Tiny particles made from a variety of materials like plastic or gelatin sponge are introduced through the catheter. These particles travel through the bloodstream and block off the problematic vessels, effectively stopping the bleeding. The procedure usually takes between 1 to 3 hours. Depending on the complexity of the case, after the procedure, the patient is monitored closely to ensure there are no complications. Bronchial artery embolization has several key advantages. It is less invasive than traditional surgery, which can be a significant benefit for patients who may not be suitable for more invasive procedures. The recovery time is also typically shorter, and the risk of complications is lower. However, like all medical procedures, bronchial artery embolization is not without risks. These may include infection, bleeding, or damage to the blood vessels. It's also possible that not all the bleeding vessels can be treated, and further procedures may be necessary. In summary, bronchial artery embolization is a sophisticated medical procedure that stops lung bleeding by blocking off the problematic blood vessels. It's a less invasive option with a shorter recovery time, but like all medical procedures, it carries some risks. As the world of medical science continues to advance, procedures like bronchial artery embolization are a testament to the amazing ways in which the human body can be treated and healed. And that, in itself, is something truly remarkable.